Good morning, Dr. Gary on the road here from Healthcare Practice Sales, where we're involved in the sale of dental practice and the brokerage of such dental practices. An older senior doctor often selling to a younger buyer, and we put that deal together. The name of our company is Healthcare Practice Sales LLC, 201-663-0935. Website www.dentalpracticeguide.com, dentalpracticeguide.com. And we'd like to give you up-and-coming advice and what's happening on a daily basis. All the information is not legal. It is not legal advice, or is it business advice? For entertainment purposes. But anyway, we have a situation now that the large DSO or private equity is buying a company, a dental office, and they went in there about 3 weeks before. We have a closing coming up, and a twist in the plans. All of a sudden, the staff are actually upset that they're being offered medical insurance. Apparently, the doctor was not offering it, and some of the staff members qualified for government insurance because they didn't have it, or their husband had insurance, or a spouse had the insurance, and this plan was actually going to cost them more out of pocket, but it was a better plan. And this is causing chaos, and you've got to manage it. And this is where we come in, I believe, and we try to negotiate, calm the staff members down, explain, because we're that buffer zone. Sometimes the buyers all of a sudden could look like the bad guy. But most of it right now is being handled by the internal team at the DSO, and we're standing by to jump in to help negotiate if there's a problem. So sometimes it does. Do you tell the staff ahead of time or not is often a question. I find on the private sales it may work out better not to tell them, so you don't get everybody upset. On the larger sales, they generally always insist on meeting the doctors and sometimes the staff. It's just required. But here's a situation where the staff is informed ahead of time and the staff is very upset. So we're trying to work this out right now. We do have a closing coming up, but you've got to appreciate the emotions which occur with staff members. Also, we're finding some of the doctors now are voicing their opinions more than they had in the past, that they want to see how things will change. Now, the senior doctor is staying on, and the younger doctors also are staying on, but you find some people getting pretty nervous when a transition is coming. It has to be managed. You have to be in control with the staff. You've got to explain everything to the staff, show them this is better for everybody. Because with this one DSO, the doctors themselves will be able to buy shares in the DSO, and financially could work out much better for them. But we'll have to see how this plays out. Right now, we're dealing with a lot of stress. A lot of the staff are upset. And you always get one or two, let's call them moles in the staff, that says everybody's quitting or wants to convince everybody to quit. And you've got to deal with this. Nothing is easy. Every deal is different. Every staff makeup is different. And you've got to just handle this through communication and finding out what the real problem is, what the complaints are. Explain to them this is a better medical insurance they're getting than what they have already. And knows that there was one staff member that had insurance that was the government insurance, but this is actually better than the government insurance. So we've got to communicate to them. Let's see how things develop. We'll keep you posted. We're supposed to have a closing coming up soon. All right, we'll see you now. It's a pleasure talking to you. Bye.